Hello, and welcome back to another episode of Straight Up with Steph. I'm going to be honest with you. I have been so nervous. I've lost sleep. I've had anxiety ever since I scheduled this episode, which was a few weeks ago. I ran into my friend who happens to be the president of the American Dental Association, Dr. Brett, at a Nuggets game. And we were just kind of discussing the state of things. And then we decided to do another podcast to hopefully clear up some misconceptions about what's going on right now. He's actually been on the podcast before. He came on last year. If you're interested in learning more about Dr. Brett and his story, how he got started, and what he's doing, I'll put a link down in the show notes for you. And just to give some context, I was Dr. Brett's hygienist at his practice here in Denver, Colorado for almost 10 years, a long time. And I feel at that practice that I found myself as a clinician, as a dental hygienist. He gave me full freedom, full support, full autonomy on the hygiene department, patient care, if I needed more time with patients, if I needed more instruments, if I wanted to refer patients out to whoever. He was so supportive of me. He had a different practice model. It was full fee for service, which gave us the freedom and the leniency and the time that we really needed to treat our patients. But it was because of that freedom and that autonomy that he gave me that I was really able to just realize my full potential as a hygienist, which is interesting because of what's going on right now. There's various initiatives popping up here and there that is allowing other people to be trained to be a quote unquote hygienist. So when I've seen these various initiatives pop up, I've just been confused because I know Dr. Brett's passion about the oral systemic link, about the power dental hygienists can have in practice and the value that they really bring. So I'm really excited to share this conversation with you. Part of why I was nervous too is I put a couple posts up on social media asking you what you wanted me to ask him. There is a lot, hygienists are nothing if not passionate. And there were a lot of comments and DMs and somewhat aggressive messages for him on what's going on right now. So I have on one hand the hygienists who want their questions answered, which I totally understand and are confused and angry about what's going on. I get it. But in the other hand, I have my over decades long friendship with Dr. Brett that I still want to be there. But I do have some questions that I want answered, and I asked them today. Maybe I don't like all of the answers that I got, but at least I asked them. You might not agree with everything I said or what Dr. Brett said today. This is just basically a conversation between he and I. But I think it's really important to not just obviously care about our own perspective, but consider perspectives of other people. What I'm talking about is the ADA, Dr. Brett, practice owners, dentists. I think we as hygienists get fixated on our role and our problems and our desires and needs, and don't necessarily think of what the dentist or the practice owner is going through too. There's a lot of practices that are really hurting right now. They don't have a hygienist. They haven't had one for a year or multiple years. They either have completely eliminated their hygiene department or the dentist is trying to like fumble around and do hygiene while also do restorative at the same time. So there's a big problem. And these initiatives that we're seeing pop up here and there, they're just going to keep coming because people need solutions right now. And I've heard solutions like we need more hygiene schools, we need bigger classes in hygiene schools, we need hygiene autonomy, which, yes, all of that is true, but it's not necessarily going to help the really hurting practices right now. We talked today about these various people who are potentially going to be trained to become hygienists, like internationally trained dentists and dental students. The ADA created a new clinical position called the OPA, or the Oral Preventive Assistant. If you don't know about either of those, the internationally trained dentist and the OPA, check down in the show notes because I've done podcasts on both of those. And we also talk most recently about this issue in Nevada. There was a bill brought forward that would, as far as this letter that I read, train what sounds like anyone to become a hygienist on the job. No education, no training besides this in-office training, and it was kept very vague, I think, on purpose. That actually was squashed last night. So the date of this recording is June 3rd, and last night that bill was shot down, and so it's not moving forward, which is good. But I think that's just one of many. So we really need to get ready and get prepared for what's coming. I know that dentistry is changing, and I think in 5 or 10 years, it's going to look very different than it is now. So we need to be prepared for that. So whether or not you agree with what I say or what Dr. Brett says or whatever, we're all entitled to our own opinion. You can always let me know what you think. Send me a DM on social media. If you're watching this on YouTube, put a comment down there. I read all of the comments. I think it's important, obviously, not to just know what's going on right now, but also be open to working together collaboratively and not slam each other online on social media. That really doesn't get us anywhere. I hope you enjoyed today's conversation with Dr. Brett. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Dr. Brett. We have got the man, the myth, the stir of pots, the ADA president, Dr. Brett Kessler. Thank you for joining today.
Hey, Stephanie, great to be here. Our last interview was one of the highlights last year, and I still listen to it and smile. I'm very excited to see where this one goes. A lot of things happening, I think.
Yes, definitely. No, and I like that episode too. You're just always so like open and honest with your story, which we talked about last time. And I know today will probably be the same, but in dentistry, there's just so much going on right now. And I know today we're going to talk mainly about hygiene. Like I want to talk about the OPA and autonomy, but I know that's only one small part of like multiple fires that you're dealing with right now. And I just can't believe that you're president like this year of all years. So besides hygiene, what are some other issues that you're dealing with?
When I ran for president, I ran on a changemaker campaign. And so I was looking to, as you said, stir the pot. I didn't expect a lot of these things to be what we were stirring, but you play the hand that you're dealt. That's what we do. I feel like sometimes I wake up and I'm living in the twilight zone with the way the world is right now. And got a very volatile political landscape with regards to fluoride, with regards to oral health. I feel like oral health is 100% under attack at its core, where public health and public access to dentistry is being challenged. Research is being challenged. HRSA grants, dental students may not be able to access grants for dental school. You know, it just goes on and on. The dismantling of the CDC oral health division is pretty radical. But we also have opportunities. And in the new administration, yeah, they're very anti-fluoride and trying to get rid of it, but they're also very pro-reduction in sugar intake and pro-reduction in ultra-processed foods, which is something that we can get behind. Yeah. And, we're, in the dental field, we can talk to our patients about why sugar is bad, and actually had the opportunity to share that with a meeting that we had in the White House a few weeks ago. And hopefully we'll be able to be engaged with them on their desire to reduce the sugar intake for this country, because it's killing America. Our diet and our lifestyles are killing America. So anyway, I really see, some challenges that are happening in the present, but I see a really bright future. I think the golden age of dentistry is right in front of us, but we have to push it forward. And I love the opportunity to be holding the reins for this short amount of time, driving that profession forward.
I honestly can't imagine someone who would be better, because you and I have known each other a long time, and you are logical, you keep your cool, like you don't freak out about stuff. So I'm like, well, I guess it's appropriate that he's president right now.
Thank you.
Today, I wanted to, of course, talk about some of this craziness that's going on in our small little world of dental hygiene. I want to talk about the OPA and hygiene autonomy. But before we get into specifics, I just want to know what your vision is in dentistry. What does a typical practice look like in 5 or 10 years, and how do dental hygienists fit into that vision?
So we are at the ADA. We have a project that Dr. Rosado is heading up. It's called Oral Health 2050. So what is the delivery of oral health going to look like 25 years from now? And why did we pick 25 years from now? Because most of us that are in practice now won't be in practice 25 years from now. Therefore, we don't have to be restrained by our current situation, and we can be very imaginative in things. But the trends are there. And one of the things that I'm pushing really hard is reconnecting the mouth to the body within our practice, and even more importantly, through the payment systems that support the profession. And because right now they're completely disconnected. Hygiene, I feel, plays a huge role in that. But we all have to think differently in how we practice today versus how we could potentially practice 5, 10, 20, 25 years from now. For those that don't know, Steph and I used to work together, and she was one of my favorite hygienists of all time to work with, because I would sit, and we had a fee-for-service practice that was focused on whole health. We treated people, not teeth, and people who had or didn't have teeth. And so what I loved, I would sit in my operatory in Op 2, and Steph would be in Op 1, and Steph would be talking to the patient who had just come back for a 4 or 6 week check after scaling and root planing, and the patient was still inflamed. And Steph would be saying things like, wow, you're doing great with your oral hygiene, but you're still inflamed. Tell me about your diet. Tell me about your stress level. Tell me about your sleep. Are you getting exercise? When was the last time you were at your physician? And I would just be doing my dentistry in my area and just smiling, because Stephanie is really making a difference in this person's life. And there were several times where you would send the patient to a nutritionist, to a chiropractor, to a therapist, to their physician. And when they come back from their physician, they were undiagnosed diabetic. I still get calls from them thanking me for, saving their lives. I'm like, no, it was Stephanie. But the thing is, when you had those conversations with the patients, you weren't paid for that. Okay. No dental benefit paid for that kind of service. In medical, they pay for that. Okay. In a consultative manner, you get paid as a physician to have these oral hygiene instruction, tobacco cessation, drug cessation, alcohol cessation, diet, nutrition counseling, stress management. I mean, all those things are paid services in the medical field, but they're not paid in dentistry. Why is that? That needs to change. And we have this opportunity to shift the practice of dentistry, because right now we're a surgical-based practice model, meaning our drill must be spinning or we must be scraping something for us to get paid.
Yeah.
Okay. We don't get paid for anything else. So in the way things were going before fluoride became a challenge, a science challenge, caries rates were dropping. Like our parents' generation had cavities in just about every single one of their teeth. And in the private practice model that we were in, basically our profit was the redoing of the restorative in those patients. Okay. In my generation, I'm Gen X. I've got much less dentistry in my mouth. Your generation, you've got even less dentistry in your mouth. And so caries rates are going down. And so we need to shift our model from a surgical based model to a management of chronic disease based model. Who better to do that than the dental hygiene profession? That's what you do.
How do we do that though? Because I mean, when we're hindered by dental insurance reimbursements that haven't changed in literally decades, and we don't have as strong a voice legislatively as the ADA. So how do we do that?
ADA is working hard at that. And
okay.
I share about this around the country. I've shared this vision with different insurance companies. We've got a couple insurance companies that are actually looking at incorporating dental benefits into the medical side as a loss leader, because they know if you invest in oral health, their systemic outcomes would be better, and they would save money on the systemic side. There's studies that show for every dollar invested in a brittle diabetic, every dollar invested in periodontal treatment in a brittle diabetic will save $4 in medical costs on the other side.
Oh, wow.
Okay. Because you can't control the sugar in the presence of inflammation. We in dentistry have this opportunity to really exploit our ability to see inflammation right at the core, in the gateway to the body, in the mouth. Okay. Hygienists measure that every single hour of every single day. And it's a beautiful thing. And now with technology, where we can do oral microbiome testing, oral DNA testing, C-reactive protein testing, all these inflammatory markers that we can detect at the earliest stage, we can prevent major health issues that will affect our patients down the road left untreated. And it's happening right now in pockets across the country.
I
Yeah.
obviously agree with that, as a hygienist, and I know a lot of hygienists do. And that kind of brings me back to what we've seen lately as far as training others to essentially be hygienists in one way or another. So it's like, I know how you and I used to practice, and it was very patient centered, fee for service. We had as much time as we needed. And then to see these things popping up, it makes me confused. And so I just like, how do you see all of that working in a practice in 5 or 10 years?
Right now, we are in a serious shortage of hygienists in this country. Every state I go to, and I've been across the country back and forth several times, everybody is hurting for hygiene services. We don't have any. And as a result, I know dentists that are dropping their hygiene departments from their restorative practices. I know of dentists that are spending most of their time doing prophies on type 1 patients, type 1 prophies. And that takes away from the dentist's ability to treat emergencies and really deal with the access to care. And so there are models out there that have proven to be effective and safe in the delivery of this care while we're fixing the problem.
Which models?
So the military has a program called the ProfiTech. It's like an advanced assistant, almost like an expanded function dental assistant, where they go through a training period and they then become able to do type 1 prophies. And they've done this for probably 15 years. It's been an active service in the military realm. And if it's good enough for our soldiers to be military and battle ready, I think we can do this on the public too. It's proven to be safe.
And that's what the OPA was modeled after, right?
Exactly.
Okay.
Yeah. But ultimately, everything, it lies on the dentist's license at this point. And in some cases, the hygienist license in Colorado, where you do have the opportunity to practice independently. So liability is shared, or is taken by the person who is overseeing the dental team in that scenario. Another area where there's a history of it and it seems to be working is in Alabama, where they had an apprenticeship hygiene model that has been in place for 40 years, and it's been able to serve the citizens of Alabama in a good way.
That's been around for a long time. But I also know, I'm like, is it working? Because Alabama is in the top either 5 or 10 of like poorest oral health in the country. So I'm just wondering, is that actually working?
There's a lot of reasons to say yes and to say no. It's a complicated situation, but they're also one of the lowest reimbursements in both dental benefits, private and public.
See, and that to me, I think it's criminal. We're struggling right now. Practice owners can't pay their team. They can't keep their team. We're having to see 1 million patients a day. And it all ties back to poor insurance reimbursement. And so it makes me happy that the ADA is addressing this. I just hope it's towards the top of the list,
On that note, I feel that the hygiene shortage and the workforce issue that we are facing right now is a direct result of the poor benefit system that we're in. Okay. Reimbursements have not kept up with the cost of living. We've not been able to pass the cost of living demands for our dental team along to them. And we've not been able then to offer the career opportunities that we were able to offer our teams even 10 years ago. The days where the dentist starts his or her practice and works with his wife as the office manager, and he hires the hygienist that, right out of school, and they work their entire career together. Those days are not going to happen anymore because of the benefit system that we're in. It's mission critical at this point that it's not working. It worked for us for a long time. About 90% of dentists take dental benefits, but I could tell you 100% of those 90% hate it, but we take it, and we did really well with it for a long time. It's not working anymore, and we're feeling it.
Yeah, I agree. And it's interesting because when I go online, there's plenty of people saying that there's a hygiene shortage, but then there's other people saying there's not a shortage. It's a retention issue because offices aren't treating their team very well. I personally think it's both, depending on like where you're at. I know an office here that I fill in for, they've been looking for a hygienist for a while, and it's a kick-ass office. So it's not really a retention issue. But I know with you gave me so much freedom and autonomy as a hygienist in your practice. I mean, I ran that perio department. You didn't want anything to do with it. You're like, you just take it. And that helped me spread my wings. And I just wonder if more practice owners allowed their team to do that also, that would just lead to better outcomes, I think.
Yeah. And I try to share that, but not everybody's open to that. There are some players in the dental field that are very open to this kind of conversation, this kind of practice model, this kind of philosophy. And there are many that aren't. And there are many hygienists that want what we just described, but there are many that aren't, okay, that don't want it. And so it's one of those things that people are people, but I think in the best service of our patients, this model will serve our patients the best. And as a practitioner, I know for me, it was the most fulfilling period of my career. And it was because I got to share it with like-minded people. And watching you, like I said, I would sit behind my mask and just smile while I'm doing my work, listening to you, because that's what I want. When I started my career, I did a general practice residency where I was a dentist in a hospital. I saw some really sick people. I saw firsthand that oral health is health, that the mouth is connected to the body and it needs to be treated as such. I wasn't just going to be drilling and filling holes in teeth. Okay, that I wanted to really be a positive catalyst to improve my patients' overall health from an oral health perspective. And I surrounded myself with people that were like-minded.
Yeah. And I know your value on systemic health, and you did high-end restorative work too. And it's like, you can't do that on a bedrock of like perio or bloody gums. So I know that you understand that. But what makes me nervous, either about the OPA or this thing in Nevada that thankfully didn't pass, but they were talking about training, it sounded like literally anyone to become a dental hygienist. And those are the things that make me nervous, because I don't think that's in the best interest overall health wise of our patients.
I think that's blown out of proportion. And I don't think it was they had to be dental assistants. They had to be trained a certain way and demonstrate competency before they could go that route. The bottom line is the shortage is grating on our members. And as a result, they're getting impatient. And so they created policies to help fast track providers into the field to provide hygiene services. And, an OPA was one of them. The fast tracking of foreign trained dentists who can demonstrate competency in hygiene can practice that way is another one. And then the dental students who had demonstrated competency can also do that. I'm not sure the dental student aspect will make a big splash in solving the access problem, because it takes them 3 hours to take a full mouth x-ray, and that won't work in the hygiene world. And
that's not what they went to dental school for,
right.
Like
but it does offer perspective though. Okay. To work as a hygienist and then to be a boss who has to manage a hygiene department without ever being a hygienist. I think there's, a lot of opportunities there for that person to be a better boss because they walked in a hygienist's shoes. Okay. And so it's like opportunities, but the right person takes those opportunities and runs with them, and the wrong just think it's a punishment. So
I just wonder too, in school, like in dental school, from what I've heard, I never went to dental school, so this is just hearsay, but I've heard that there isn't business training. There's not leadership training. And I'm like, man, would that make more sense than training them to like clean teeth so that when they get out, they actually know how to run a practice? Because so many don't.
Yeah. There is business training and there is leadership training in every dental school. It's just not the focus of the dental student. Okay. They're busy about getting through their clinicals and things like that. And the bandwidth is only this big, and, but it is there. And when a dentist graduates from dental school and when a hygienist graduates from hygiene school, they're competent. They're not masters. Okay. Yeah. It takes them a long time to build their styles and their skills, and not just their physical skills, but their communication, their soft skills, to really be effective. Okay?
And that's why these fast track things scare me, is because it does take time.
Yeah. Again, another model that is different, but similar. In Colorado, we have zero regulations whatsoever on dental assistants. I could take someone from Starbucks and who I think has got great people skills, and I could train that person to be a dental assistant, and I could train them to be an expanded function dental assistant. There's no regulation whatsoever. Amity was our assistant that worked with Steph and I, was one of the best assistants I had ever been with. Okay. No regulation whatsoever. Okay. So the potential for the person to thrive given the right opportunity is there. Okay. And not necessarily because of the regulations in place. I can also tell you in Colorado, there are tons of dentists who are utilizing dental assistants for this very purpose right now, whether it's legal or illegal. Okay.
For hygiene, you mean?
Yep. Yep.
Yeah, I know. I've heard that too.
And there's not a darn thing I could do about it, and not a darn thing you can do about it. But this is a way that we're just trying to solve an access issue. But I really believe that, so from a dentist standpoint, if I never had to do a crown on tooth number 2, so I'm right-handed, so that's the hardest tooth for me to work in, upside down, backwards, they open up this much. If I never have to do that, and if I can defer that and turf that to a young dentist in my practice or a dental therapist to do, I would do that every single day. Okay. From a hygiene standpoint, I would assume that knowing you would love to do the complex periodontal involved cases. Okay. And let the hygiene assistant or the young hygienist or whatever, this OPA, do the type 1 prophies while you're trying to make a difference, reversing systemic disease. Okay. And in the bigger picture of things, a lot of the skills that we are very protective of can be delegated. And we, with our knowledge and our experience and our training, we can do so much more good for our patients, if we can leverage that. And I'm
so
not
is that
saying
kind of what you're thinking in a practice, like the OPA or whoever would be doing these like easier prophies, which honestly, there's not a whole lot of them, not in my experience, but anyway. And then the hygienist.
Okay, but like for kids, okay? I mean, how long does it take to do a kid prophy? You know what I mean? It's like,
it's just tough because I've seen kids come from pedo practices when they're 18 and they need SRPs because no one's removed calculus. And that might just be that one practice. I don't know. But then the OPA is handling maybe the quote unquote easy ones, and then the hygienist is handling the more difficult ones. And then people, it seems like we're never happy, but hygienists are like, I don't want to do like complex perio every day because it's hard. Great. And it is hard. So it's great. It's like, you guys, I respect the initiative to try to come up with solutions, because from my side, I see a lot of bad mouthing and complaining and shooting these initiatives down, but not necessarily creating solutions of our own on the hygiene side. I'm probably going to get in trouble for saying that, but I just don't necessarily know, especially this thing with Nevada. It scared me. And I think that we're going to see more of that coming up.
Yeah. And just like dental therapy, it's been being introduced across the country for the last probably 15 years or so. Yeah. And I could tell you, when I was president of the Colorado Dental Association, that was 10 years ago. And I tell you, every president of the CDA, when at the end of our term, we're like, whew, okay, we beat the dental therapy. It didn't happen on my watch. And it kept coming back. And it finally did pass in Colorado, and it passed in, I think, 14 states around the country. The same thing's going to happen with this. It's not going to go away. It's going to keep coming.
Oh, okay. Yeah, totally. Yeah, I know. People are all like celebrating today that it didn't pass. I'm like, but we'll probably see another one next week. So
right. And we're getting out of legislative season across the country. So there's not a lot of states in legislative session right now. I think we're going to be quiet for a bit, but I think it's coming. I think it's coming back.
Yeah. Well, and people are going to see like maybe the pros and cons of what just happened and then bring stuff up next time.
But we did a great thing in Colorado. We've got a great relationship. The Colorado Dental Association and the Colorado Dental Hygiene Association have been working hand in hand together for the last 15, 20 years. And we've been able to solve a lot of the problems. Yeah, we still have a hygiene shortage, but over the last, 3 to 5 years, because we were able to work together, we doubled the number of hygiene students that we're training in Colorado, because we saw this as a problem when we wanted to do a mutual solution. And it's sad that I can't, recreate that around the country.
What's the problem? Is it just people like not wanting to work together?
Yeah, that's what I'm seeing. and it's unfortunate. It's protectionistic attitudes on both sides. That's all I'll
Yeah.
say.
Well,
There's a lot
it's
I
like
could
I've
say,
been
but I won't say.
no. I've obviously been thinking a lot about this. And, if we talk about a relationship, like a romantic relationship, sometimes it goes bad, right? And those people just need to part ways. And I'm like, is this kind of the same thing with the ADA and the ADHA? Because it doesn't really seem like there's a lot of collaboration. And so maybe it's time to just.
I will say that we had a meeting with ADHA in January at my request. I was excited to work with them to talk about what I just talked about with the vision of oral health delivery. And I want hygiene, and I recognize and respect hygiene's role in that and want to leverage that. And I was excited to talk about that, and it did not go very well. It did not go very well. We started talking about this, and it really went right to the policies that were put in place at our House of Delegates around foreign trained dentists. And I could not break them from basically arguing about that. So we ended that on a down note, and immediately we were trashed by them in social media. And I was really disappointed in the leadership of that, because that's not how we get to solutions. And so then we got a call from them a few weeks ago to revisit another conversation. We were all like, yeah, let's do it. And so we got something on the schedule, and literally a week and a half ago, we got an email from them saying, due to the heightened political tensions, we decided we're not going to meet with you. Thank you. And that was it. I was like, oh, and I had no idea what was brewing in Nevada. Okay. And frankly, I'm dealing with all these other things within the ADA and with the U.S. government around fluoride and science and things like that hygiene has not been high on my radar. So I didn't think twice. Oh, okay, I guess I don't want to meet. And then a few days later, the Nevada thing came up, and I was like, oh, I see why they didn't want to
And
meet.
you think that was a factor?
I really do.
Okay.
But again, I didn't get the chance to talk to them because they won't talk to us. We're ready to create solutions, but the solution is increasing the number of hygiene students so we can increase the number of hygienists in the field. And that's where we are putting our efforts. And so if ADHA would like to play a part in that, we would welcome that. If they don't, we're still going to move forward with that.
So that's like creating, maybe not necessarily even creating more schools, but like increasing class sizes.
And this is something that ADHA has known for a long time, that there's a shortage, and they know there's problems with CODA and the requirements it takes to actually run a dental school. And we're left to clean it up. Okay. It's not our scope. It's your scope, ADHA's scope, but they're not helping.
But aren't we like tied? Like, I feel like from what I know, and I don't honestly, I will be the first to admit, I don't know a lot about this legislative like autonomy stuff. Okay. I'm learning. But as far as dental hygienists, aren't we kind of tied? Like our hands are kind of tied because we're under the umbrella of the ADA. Like we can only do so much.
Of the ADA. You're not under the umbrella of anyone. You're your own entity.
So what's this whole autonomy?
Dentists.
Like explain autonomy to me then.
Colorado has had independent hygiene for 40 years now?
It's been since the 80s. Yeah.
Yeah. And it's actually been, I think, a good thing for providing improved access to care in our state. Mm-hmm. Yeah. Okay. And many states around the country, that's what they're going for, autonomy. They want independent practice.
Yeah.
They don't want to improve the number of hygienists in the field. They want to practice independently of dentists.
Okay.
That's what I'm gathering is their issue. And yeah, that's great, but it's not going to solve the problem that we're in right now. And there was no interest in helping to solve that problem.
It's a volume issue. We need more bodies, basically. So when people say, because I see this all the time, Dr. Bratt, online, like the ADA opposes hygiene autonomy. Is that a false statement?
There's no truth to that whatsoever.
So if a state, because I'm in Colorado, thank God, but if a state, like if hygienists in, I don't know, Ohio or somewhere want autonomy, that starts at the state level. That's not really even an ADA issue, right? It's like that state's dental, but the dental association has to agree.
The Ohio Dental Association is a big political lever to drive the Practice Act for the state of Ohio, but so is the Ohio Dental Hygiene Association.
Okay.
It's a state law. It's not owned by anyone but the state.
Okay.
So we as a national organization, we have a policy around dentists being the captain of the team per se, but what does that mean? Even in Colorado, where there is independent hygiene, you have a relationship. If you are an independent hygienist, you have a relationship with a dentist to refer back and forth to for dental work.
Yeah, but it's like a collaborative. It's not like a I'm in charge of you type thing.
Right.
So what?
You're not the boss of me, Steph.
I am right now. It's my podcast.
That's
right. So when we get back to kind of, I guess, the tensions, because in my experience, so I've been a hygienist for almost 20 years, and there has been a tension between dentists and hygienists here and there for most of my career, and it's getting worse. So do you have any ideas or solutions on how we can move forward collaboratively and stop attacking each other?
Yeah, I really feel the catalyst is the dental benefits. I don't hear hygienists talk about dental benefit improvements very often, especially if they want independence, which I would never fall on my sword for that, for hygiene independence. If you wanted dental hygiene independence and you had your own dental practice, you would get paid by these dental benefits. It would be a much bigger source of angst for you. But that is the cause of the problem. And I think that we need to work there. And then, just as dentistry evolves, the practice of dentistry will demand us to complement each other's services. But we're not quite there yet. And so it's just going to have to ride this out. But it's a human thing too, that as a former boss, I really valued my team. That was one of our core values. It was our first core value, the power of team. And not everybody feels that way. And but I feel that my team was never an expense on my P&L. It was an investment. Okay. Yeah. And that's how I treated the people that worked with me.
What do you wish that we as hygienists or any team member really, what do you wish we understood from like a dentist or practice owner perspective? I really want to be curious about this because there's a lot of hygienists, I think, that just don't even think about that.
Dentistry is very hard. It's hard on the body. It's hard on the mind. It's hard on the psyche. It's hard on the spirit. As a practitioner of dentistry, it is very hard. It's hard on hygienists too. And I think hygienists don't see how hard it is to be a dentist. Mm-hmm. And on the flip side, I don't think dentists see how hard it is to be a hygienist. We really need to have this namaste attitude and recognize everyone's struggles and everyone's opportunities. But dentistry, the students are coming out of dental school with $370,000 in debt on average. And most of them have never held a job before. This is their first job. And so now they're expected to do this complicated skill of dentistry, manage people, and then manage a dental team. And it's tough. It's really tough. We need to take care of ourselves and we need to support each other.
Yeah, I just can't imagine. Okay, me as a hygienist when I was full-time, like you're right, it is hard physically, mentally, there's just like all of it, it's hard. But I'm like, what if I also, while I was providing treatment, had to worry about payroll and the electricity bill and the rent and legal stuff. Like I cannot imagine the stress of a practice
and living issues and your dog issues and all that, life.
Yeah.
It's stressful.
Yeah. And the overhead of a practice too. I think people maybe don't think about that. They think I just want $5 more an hour, which really isn't quote unquote that much, but it's like when you're adding up everything else and you're not producing, like we can get into production and stuff too, but I understand it from a practice perspective, but I do think a lot of this stems from insurance. And it sucks because a lot of hygienists feel like they're being punished because their office takes these shitty plans and then they aren't able to make more money.
Yeah, that's the business philosophy. And there's so many ways to practice. There's so many different practice philosophies out there, and we feel like we're stuck where we are. And I don't blame a lot of the dental hygiene, have left the team mentality and went and started working independent and per diems, and I'm like, I can relate, you can get basically almost the same salary on 3 days a week that you could on 4. You can dictate your hours, have zero responsibility as far as, working recall and all that stuff. And,
Yeah.
they leave and they're gone. And so they can preserve their body and live a better life. And that's their personal choice. And I would do the same thing as pretty much any other dentist would. But it hurts the dental team, especially those that have this expectation of working with this team and growing this team and providing for our patients with this wonderful team, what we had. And it was like almost, 10 years ago now, man. It's sad.
Was
It was
it?
a long time ago. Yeah.
I'm just like, I actually, last night I was trying to figure out, I'm like, how long have I known Dr. Brett? And I like stopped because I couldn't figure it out. It's been a long time. Yeah.
But so there's a lot of unrealized expectations, and it leads to angst and heightened tension.
And there's, I mean, definitely blame on all sides, like insurance, practice owners that maybe don't value their team. Hygienists, I don't think we did ourselves any favor after COVID, like asking for these super high hourlies. And then we've now got new grads that are coming out wanting to get paid like 60 or 70 bucks an hour. Like that's everything's just gotten really weird.
Yeah. I wake up every morning and wonder if I'm in the twilight zone. I don't. This new reality that we're in is just so far from where I expected we would be in 2025.
But I guess I've been around long enough to know that a lot of times things get harder before they get better. So hopefully things will get better in the next, I don't know, couple of years.
Yeah, it's not going to be an easy solution. It's going to be several years of everyone trying to figure it out, and that's just human nature. And it's America. We're in a capitalist society. The dental offices need to make money. The dentists need to make money. Everyone who delivers dentistry needs to make money. And so we shouldn't be ashamed of that. Whether you're in private practice or in your public health practice, there's got to be a solid business plan for this to work.
Oh yeah. Yeah. And increased, I don't know if I learned this at your practice or somewhere else, but with production, a lot of times people feel like they shouldn't have to track production or it's unethical or whatever. And it's like, if you have a high production, that means you're helping a lot of patients. It's just like kind of reframing how you're looking at it at that.
Yeah. When the IRS person wants their money, I'm saying, well, I don't track that. They don't like that answer.
So speaking of money, what do you say to people who see these internationally trained dentists or the OPA or this Nevada thing? What do you say to people who say this is just a money grab? Like you're just trying to pay team members less money? Just dentists.
I would say that if the payment should be commensurate with the skill. Okay. And so if you are providing a skill, there should be a definite pay range for that, and the market will dictate that. On one end, the hygienists, as you mentioned, got kind of greedy right after COVID we're asking for an awful lot of money, but can they justify that? There has to be a business sense for that. Okay. Yeah. So if your staff overhead should be 25% of your overhead. So if you made $50 an hour, therefore your $50 an hour would have to multiply it by 4. That's 25% times 4 is 100%. You would have to justify 50 times 4 is 200. Okay. And $200 an hour is what you would need to produce. Right. So that's how the math works in that. And, we can't lose money on it, but I loved how we tracked it when we worked together. Yes, it was important that you were producing, but that wasn't the key indicator for me. The key indicator for me was how much was being diagnosed in your chair, because you were complementing the overall health of the patient. And so how much dentistry was diagnosed and then scheduled out of your chair that showed your effectiveness. Your production, that was okay, but it was way more important that you were complementing the restorative side and driving the restorative side because you saw problems, and using your clinical judgment and your ability to connect with patients in an amazing way brought success to the practice.
But I was given the time and the autonomy to do that. And how can hygienists do that when they're only given 30 or 45 minutes per patient right now? There's no way.
Right. And that's a reductionistic practice model where you're treating teeth, not people. But that's a legitimate practice model. And we attracted a patient base that really wanted that slow care. But consumerism today, that's not always the case. They want in, they
Yeah.
want out, they don't value, and they don't care. And many practices cater to that. I shouldn't say they don't care. They don't care to the level that the patients that we had cared about their overall health. But there's a place for all these practice models in dentistry. And if you are stuck in a practice you don't like, it's a free country. You can change your job. And
Yeah.
and I encourage you to do that.
And there are hygienists out there, I consider myself one that like really is part of the team, wants to contribute to the bottom line, wants patients to like get whatever they want out of their oral health. If it's veneers or ortho or whatever it is, yeah, let's talk about it. But then we have hygienists that just want to come in and just clean, scale teeth and leave. Like they refuse to take
Right.
x-rays, they refuse to help out anyone else. So I get it. I guess there's a spot for everyone. What are your thoughts now about the dental therapist? Because you said a long time ago you had not been a supporter of it, right? Has that changed?
Yeah, I still, I haven't seen it actually work in the field here in our country. The payment system that we're in doesn't pay for it, doesn't support another surgical model in our profession right now. But what if, let's say, a dental benefit happened in Medicare tomorrow, and now we had 80 million seniors who all of a sudden have dental benefits that didn't have it before. There's no way the current delivery model would be able to support that influx of new patients. And so we have to find alternate ways to deliver dentistry. Dental therapy, I don't know where it's going to lie in other countries. There has been some positives, but again, it's questionable and controversial whether it's been positive or not. But I think we all need to be real creative in how dentistry will be delivered 25 years from now, because it's going to be different.
This is just me talking about me. I don't ever want to be one of those people who claims their turf and doesn't want anyone to like encroach on that and hold people back from wanting to advance forward should they want to. Like with this OPA, that even the foreign doc thing, I was just like, okay, is this my ego talking, or is this like logic and concern for the patient? I still struggle with that, but
if they can
thing,
demonstrate,
I did not agree
but
with
if they
that
can
at all.
demonstrate competency,
Who's testing the
then,
competency though?
well, that's on the backs of the dental board. Okay. Their job is to protect the public. And if this is a law that passes, the dental board's job is to protect the public. So they have to ensure that everything is in place, that the public is safe.
Are boards primarily made up of dentists? I know
It's
there's
dentists,
some.
hygienists, and consumer members, usually
Okay.
non-dental members.
Okay, because that was one of the things that really concerned me about Nevada is the dentist would be certifying them, and
There's
I
dental
don't
hygiene on that board.
Okay, I just didn't think dentists should be the one establishing competency for hygiene. That was probably my biggest issue, actually.
Really?
That and subgingival scaling. I don't think that can be trained on the job either. Like, do you think that can be trained on the job?
Yeah, I do. I really do. Like I said, I had dental assistants who would remove cement for me, subgingival crowns. They did it pretty well. Okay. They may not do it as well as removal of tartar from you, but I think it's a learned skill. And you weren't as good at it 20 years ago that you are today. I think it could be taught.
I mean, I don't know. I had a lot of training on like root morphology and stuff. I mean, do you think drilling teeth could be trained on the job?
I do. And I've watched it with expanded function dental assistants. Okay. They're not drilling on teeth. They're drilling on composites.
I mean, I don't know anything about drilling. Is drilling composite different than drilling a natural tooth? I don't know.
Yeah, but they don't know the difference.
Okay.
Again, there are dental offices that the dentist would go in and just cut holes and then they leave, and then the dental assistants would fill everything.
Yeah, right.
Okay.
I know they're like little mini dentists. And I get what you're saying, Dr. Brett. It's like we have to be open because things will change whether we like it or not. I just would hope that these competencies or testing or whatever is just, I don't know, done at a high level and by the appropriate people.
Yeah. And that burden is left to the dental boards, who their job is to protect the public. So if these laws happen, the dental board must establish competency.
Okay. Well, before we wrap up, because I know your time is very valuable, what is the latest on the fluoride issue?
I could tell you the state of Louisiana successfully killed a bill to remove fluoride from the water systems
Okay.
yesterday. So we're very happy about that. So that's the
Mm-hmm.
hot news, but it's still being challenged. We are trying to promote good science. A few weeks ago, Dr. Rich Rosado and myself had an opportunity to go to the White House and meet with Dr. Heidi Overton, who is the Deputy Director of Domestic Policy. She meets with the president 2 or 3 days a week, and she was heading the MAHA project. And so we met with her literally 2 weeks before the MAHA report came out. And we spent about 45 minutes with her talking about different aspects of oral health and the government's responsibility. And she asked a ton of questions about fluoride. And in that final MAHA report, the fluoride tone was toned way down. Okay. And they're looking at EPA recommendations to set it in the fall. We had met with the EPA a few weeks prior to that. And so we're helping the EPA as well establish the true levels and whatever they may be, and helping them with data and accumulating the studies for them so they can read that. So we feel like that we made some groundwork, but then immediately there's an announcement that FDA is removing fluoride supplements from the market due to neurotoxicity. So we're banging our head against the wall, and I don't know the rhyme or reason. So we're willing to work with the administration and finding ways to do that, because we are in the midst of a perfect storm. A mess is being created by removing fluoride. We see that there will be probably a 25% increase in decay rates, especially among kids in rural areas. And then the Medicaid cuts will really hurt, because the problems that we're causing now, we won't be able to fix later because there'll be no funding for it. We're getting worried. So we're fighting like crazy to advocate for what we know is true science.
With the fluoride thing, like for me, I'm all about personal choice. That's probably the most important thing to me. And when I look at the fluoride, community water fluoridation, I kind of get it from people who don't want it in the water. Like I get their perspective. But then when they took it off of shelves and took away that choice of people who wanted it, I'm just like, what the hell? Like, at least give them a choice.
In a public health model, though, we don't look at individual choice. And a lot of especially lower income families, they have no choice. They don't access dental care. Their parents are working. Okay. If the dentist or the dental hygienist isn't coming to their school, they're not going to see a dentist. Okay. Many of them can't afford fluoride toothpaste. Many of them can't afford their own toothbrush. They're sharing toothbrushes. Okay. That's the reality of a good portion of our country. And they don't have the choice. And their income, many of them, they're on welfare, they're on SNAP, they're on food stamps, and there's no Whole Foods in their neighborhood where they can go get good food. Okay, they're eating ultra processed, high sugar, high carb diets on their own, and we're trying to mitigate a big problem. Okay, there's a big problem in our country.
Yeah,
so it's not about choice. For many of them, don't have choice.
Okay. And I do like what you said earlier. Like, that's something I like about the new administration, is they seem to at least want to change the whole food issue. So hopefully we'll get some progress there.
Yeah. And we're ready to help with that.
Yeah. Well, thank you so much for your time, Dr. Brett. Any parting words before we say bye?
No, I always appreciate our conversation. Something good always happens when we get together. Glad we got to run into each other at the Nuggets game a couple of weeks ago.
So if anyone wants to reach out and contact you, is there a best place for that?
Yeah. Email kesslerb@ada.org. Social medias. You guys know how to get a hold of me. Trust me, I'm hearing a lot from your colleagues, and I appreciate it, but there's no easy solution. And we're not trying to be nefarious and put down the hygiene as a profession. We as dentists value what you bring and what you do for dentistry. So I hope we can work forward with that in mind.
Thank you for saying that. I think that'll mean a lot to a lot of people. And yeah, we just need to play nice and move forward. Yeah. All right. Well, thank you so much, Dr. Brett. And thank you everyone for listening. We will see you next time.